So you're about to enroll in Medicare. How do you decide which Medicare plan is right for you? It can be confusing as you research the pros and cons of Medicare Advantage Plan versus Medicare supplements. Where do you start? In this video, I'm going to take you step by step through the decision-making process so you can be confident in your choice of Medicare plans. Also, at the end of this video, I have a frequently asked questions section that is a must-see. I answer the most common questions we hear from people researching Medicare, and that alone can save you hours of time and heartache. Hi, if we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org, one of the country's premier agencies specializing in Medicare. We work with people in 49 states, and our services are free to you, the consumer. Before I get started, if you find this video or any of my videos helpful, please click the subscribe button below and the like button as well. I'm always surprised when people don't realize that I've produced dozens of videos on various Medicare topics. When you subscribe, you'll find my other videos more easily, as well as the new videos I post on Medicare. You also help to spread the word, and so others like you can find my videos. When you're ready to start Medicare, the first thing you do is enroll in Medicare Part A, inpatient insurance, and Medicare Part B, outpatient and physician services insurance. Together, these two are referred to as Original Medicare. If Medicare is going to be your primary insurance provider, you must enroll in both Medicare Part A and Part B. Enrolling is typically done through the Social Security website or via a local Social Security office. Medicare Part B has a monthly premium based on your income. Medicare Part A, for most people, is already paid for through the payroll tax deduction from your paycheck for all those years. Once you have your Medicare, you're not required to do anything else except get a Medicare Part D prescription drug plan. However, you do have two other choices or two other options to consider. One of your choices at this point is to trade in your original Medicare for a Medicare Advantage Plan, also called Medicare Part C. The Advantage Plan is a privatized version of Medicare that replaces your original Medicare. Your other choice is to keep your original Medicare and add a Medicare supplement to fill in the gaps in Medicare coverage. It's important to remember that no matter what choice you make, you will still be required to pay your Medicare Part B premium and any IRMAA charges for high-income earners. If you want more information on IRMAA, the income-related monthly adjustment amount for high-income Medicare beneficiaries, check out this video over my left shoulder. Now, let's look at these options very carefully. First, what do I mean by gaps in coverage covered by a supplement plan? There's a link above my left shoulder where you can download and save the benefits of Medicare Part A and Part B. You can also find it, by the way, on my website, MedigapSeminars.org, in the resources page. When you see it, you will notice that Medicare has significant deductibles, coinsurance, and copays, as well as limited coverage in some areas. Those deductibles, coinsurance, and copays are what a Medicare supplement pays on your behalf. Now, I'll get back to that in a moment, but for now, the big issue at this point is that most people researching Medicare come across a multitude of videos and articles comparing a Medicare supplement plan coverage to a Medicare Advantage plan. All you have to do is search Medicare supplement plans versus Medicare Advantage plans on YouTube or Google, and you'll know what I mean. But if you're trying to figure out which is best for you, this is not the best way to go about making that decision. Why? Because Medicare Advantage plans do not compete with Medicare supplement plans. Many newer insurance agents and some of the public believe that a Medicare Advantage plan has all of the same coverage as a Medicare supplement, just a different price or cost structure. And that's not true, not even close. Medicare Advantage plans are designed to compete with Original Medicare all alone. They're a privatized version of Original Medicare, with some adding a bundled Part D prescription drug plan and other benefits not directly related to Medicare. Advantage plans were created with the intent to give the consumer a choice beyond Original Medicare. So now let's go back to the Medicare Parts A and B benefit sheet, and I'll go over how both the Advantage plans and supplement plans fit in. If you have Original Medicare with no supplement, this is your insurance. Now, as I mentioned earlier, there are a lot of gaps where you pay a portion of the Medicare costs. However, one of the greatest benefits of Original Medicare is that you can see any doctor or go to any medical facility in the United States or its territory as long as they accept Medicare. And that's nearly every doctor and hospital in the country. You don't have network limitations. The biggest weakness of Original Medicare by itself is that it has no maximum out-of-pocket. You can theoretically have unlimited liability with just Original Medicare. But what about your cost for medical bills? Well, let's start with Medicare Part A inpatient coverage. And here you'll note a large deductible. For 2024, it's $1,624. This deductible resets when you are out of the hospital, discharged from the hospital for 60 days, which means you can pay that deductible more than once per year. Any stay as an inpatient in the hospital will trigger this deductible. If you're under observation, that would be under Medicare Part B and not Part A. So with Part A, after paying the deductible, you then have 60 days of hospital coverage before there are additional charges. Those daily charges increase at 91 days, and at the end of 150 days, they're over. If you are unaware, the deductible for Part A and Part B change annually. It's typically announced in November of each year. Then, with Part A, the first tier of daily copay is 1/4 of the deductible, and then the second tier is always 1/2 of the deductible. So how do Medicare Advantage plans compare? First, understand there are nearly 4,000 different Medicare Advantage plans across the country, each with their own version of Part A and Part B, their own benefits and costs, and they change every year. Medicare rules do not allow an agent, such as myself, to go over specific benefits of any specific Advantage plan without the consumer signing some forms and both of us going through a few hoops. But in general, you will find that most Advantage plans have a Part A deductible that is similar in scope to the Medicare Part A deductible. In general, you will also find that after you meet that deductible, with most plans, you're going to have 100% inpatient coverage as long as you stay in network. In addition, all Medicare Advantage plans have an annual maximum out-of-pocket, and this puts a limit on your financial risk. The maximum out-of-pocket amount varies from one Advantage plan to another, but can be no more than the annual limit set by Medicare. I touch on some things people often ask about this in the frequently asked questions section at the end of this video. But I think that many will agree that based on just the Part A comparison, the Advantage plan appears to offer more than Original Medicare without a supplement. But keep in mind, because Advantage plan participants have given up their Original Medicare for a for-profit insurance company, they must follow the insurance company rules. One of those rules is that you are restricted to the hospitals and the doctors that are in network with the insurance company. Out-of-network hospital stays can be cost prohibitive. Medicare Advantage plans also are just local coverage, only paying for emergency and urgent care when you're outside of your local area. A second rule is that the insurance company may require your doctor to get their permission or pre-authorization before performing any non-urgent procedure. Another important feature is that your Advantage plan benefits change every year. You cannot assume your benefits for next year will be the same as whatever you have this year. So that's the information that you need to compare the health benefits of an Advantage plan to those of original Medicare without a supplement on a high-level basis. With this information in mind, you can then examine the details of the specific plans, the Medicare Advantage plans, for an informed decision. But this is the apples-to-apples comparison that was intended when Advantage plans were created. So next, we're going to look at how the Advantage plan compares to a supplement for Medicare Part A. And then I will cover Medicare Part B, and finally our frequently asked questions section that I know you're going to love. But first, consider this. Hi, I just wanted to take a moment to be sure you're aware of something that you may find helpful. If you're just researching Medicare and trying to figure out which plan is right for you, you may find my free Medicare Mini-course helpful. This is a 4-part course of short videos to help you understand Medicare so that you can make an informed decision. Just head on over to MedigapSeminars.org or click the link above my left shoulder. And look for the talking head in the lower right of the screen. When you click on it and choose the free Medicare Mini-course, you'll be glad you did. Oh, and if you like this video so far, please help me out by pressing the like button and feel free to leave a comment or a question. So let's get back to the video. Okay, next is how does the Advantage plan compare to a supplement? There are 10 different Medicare supplement plans if you exclude the 2 high deductible options. Of those, all but 2 would pay every inpatient Medicare expense not covered by original Medicare for Part A. As a result, you would have no out-of-pocket expenses for inpatient care. 0. In addition, when you have a Medicare supplement, you keep the benefits of original Medicare. You can see any doctor, go to any medical facility that accepts Medicare anywhere in the United States or its territories. There are no network limitations and there are no prior authorizations. Even more, the benefits never change. You do not need to reshop your plan every year because it doesn't change. If the deductible increases from $1,624 to $2,000, it doesn't matter. Your supplement will pay it. So what is the downside of a Medicare supplement plan? Well, Medicare supplement plans have a monthly premium. The insurance premium depends on where you live and your age, but can be under $100 a month or over $300 a month or anywhere in between. So that is Medicare Part A and your 3 choices. In my opinion, many Medicare Advantage plans are a better choice than original Medicare alone, as long as, big caveat, as long as network limitations and pre-authorizations are not a concern. Your best coverage, however, comes from keeping your original Medicare and adding a Medicare supplement. The consideration in that case is simply the affordability of a supplement plan during your retirement. Now let's look at Medicare Part B. And Part B is outpatient and physician services. Physician services include both outpatient and most inpatient physician care. Part B also includes most medications that are administered by a professional in a medical facility. And that includes shots or infusions and so on. With original Medicare, there's a small annual deductible that you pay once during a calendar year before Part B benefits begin. For 2024, that deductible is just $240. After the deductible is paid, Medicare covers 80% of your bill, and you pay 20%. Lab services and home health care are generally covered at 100%. However, you have no insurance coverage for something called excess charges. Now, please don't get rattled by the potential for excess charges. As the saying goes, there's more bark than bite. If you want to learn more about excess charges, please see my video titled Excess Charges Are Dead. I've linked it above my left shoulder there. Preventive care for Medicare is very limited. Preventive care is covered at 100%, but they're not thorough examinations. They're not physicals. They're what we call wellness visits. When performing a wellness visit checkup, many doctors will add an extra service in there that's not covered by Medicare preventive care, and that often results in surprise billing. Now, I have a video on this with details on how to avoid surprise bills, and if YouTube will let me link it, I'll put it up there. YouTube has a limit of how many videos I can link up there, but if not, it'll be in the show notes below. Keep in mind, with Original Medicare, you have no network limitations and no pre-authorizations. So how do Advantage plans compare? Many Advantage plans do not have a deductible for Part B services. Some do. In fact, some of the Advantage plan deductibles are substantially higher than Original Medicare. It simply depends on the plan. You'll typically also have a copay for office visits and lab work. Again, you're going to have to see the specific plans for details. Network limitations are a big deal in outpatient care because out-of-network costs can be high, or you may have no coverage at all for out-of-network care, and certainly possibly a higher maximum out-of-pocket. And of course, prior authorizations for most care will be required, and again, can be a significant hurdle. On the positive side, usually Advantage Plan preventive care is more comprehensive than Original Medicare. Many, not all, but many Advantage plans have a zero premium, as I believe they should, because they're not meant to build on Original Medicare, simply replace it. So it really shouldn't cost you any more. Still, two of the biggest weaknesses of Advantage plans have to do with cancer treatment and with Medicare Part B medications. Every Advantage plan I've seen simply covers 80% of your cancer treatment, leaving you to pay 20% up to your maximum out-of-pocket. And the same with Part B medications. And this can be cost prohibitive for some, especially when you consider that the maximum out-of-pocket resets every January 1. And that means if you're receiving expensive cancer treatments late in the year and it rolls over into the new year, you're likely going to have to pay your maximum out-of-pocket all over again. Because Advantage Plan maximum out-of-pocket limits reset every January 1, you must consider the possibility of paying that amount twice or 2 calendar years in a row. If your medical needs are late in a calendar year and then continue into January, the maximum out-of-pocket deductibles and so on all reset on January 1. Many Advantage plans throw in some services that may include dental coverage, meal plans, and gym memberships. And I call these shiny objects. While they're nice, keep in mind that the details of these extra benefits will change every year. More importantly, you need to make certain that your major services healthcare insurance is right for you before you consider the shiny objects. So let's compare this to a Medicare supplement. Specifically, we will use the two most popular Medicare supplement plans, Medicare Supplement Plan G and Plan N. According to an industry survey done by GenRE, 95% of all Medicare supplement plans purchased by people new to Medicare as of 2022 are either the Plan G or the Plan N. Now, my comments on these two plans will be brief in this video. For more details, check out my video on how to choose between a Plan G and a Plan N. If I can't link it above my left shoulder, it will be in the show notes below. I will also have more information on this for you in the frequently asked questions segment coming up shortly. Of the two Medicare supplements, Plan G has the most coverage, with your only expense for Medicare covered care being the annual Part B deductible, which is currently $240. That's it. $240 is your maximum out of pocket for 2024, and that can go up a little bit every year. I will also try to remember to link. I have a video that shows Medicare's estimates for the Part B deductible and Part B premium going out for the next 10 years. And if I forget to link it below, again, if you subscribe to my channel, you'll be able to find that video very easy. These are estimates that have been very accurate historically, so you can kind of plan out what your Part B premium and your Part B deductible will be in the years ahead. With Plan N, you're going to pay the Part B deductible plus an office visit copay. It's for every office visit, and it's no more than $20 per visit. In addition, you will need to avoid Medicare excess charges. Now, in my opinion, that is a non-issue. Again, see my video, Excess Charges Are Dead. After this one, of course. As mentioned earlier, the risk with a supplement is the monthly premium. It will increase over time. And again, you can see any doctor, go to any medical facility in the U.S. or its territories. You can see the doctor of your choosing. They can be halfway across the country. There's no pre-authorization requirements. Your healthcare decisions are between you and your doctor. No insurance company can interfere. So what should be obvious from this discussion is that the healthcare insurance coverage of Medicare plus a supplement is vastly superior to that of an Advantage plan. As long as you can afford the monthly premium, that is a choice that you should make. Now, we're going to cover the frequently asked questions next, but hopefully you can see that there's really no comparison in benefits between an Advantage plan and then original Medicare plus a supplement. And that's because the Advantage plans were never meant to compete with a supplement. They are simply an alternative for those who are considering choosing original Medicare without a supplement. Now comes the frequently asked questions part. These are questions we get on a regular basis that I think is going to help you to understand some more of the details of what we just went over and some more about your Medicare. So let's just get started with the first question. Do I still pay the Part B monthly premium when I have an Advantage plan? The answer is yes. You cannot get away from the monthly Part B premium. And if you get an Advantage plan or a supplement, you must pay the Part B premium. You must also pay any IRMA charges, any charges for having a higher income. So you can't get away with it. I've seen a lot of people try to say, well, I've got IRMA charges, I'm going to get an Advantage plan so I don't pay the Part B premium. Can't happen. Next one. What if one of the doctors in an operating room charges an excess charge? Good, there's some misinformation out there that we've run across quite a bit. Bottom line is, you can't be surprised by a Medicare excess charge. You can't have an anesthesiologist or some other doctor in an operating table charge an excess charge that didn't already tell you they were going to. They are required to inform you ahead of time. And of course, you can negotiate and say, well, I don't want to charge an excess charge. If you're going to be my, your group is going to be my anesthesiologist group, then I want no excess charges. You can do that. But the bottom line is there can't be any surprises. There can't be any people just showing up out of nowhere charging an excess charge. There's an all or none rule. So if you have, in a doctor's office, so let's say you have a group of doctors, Timbuktu orthopedics, either every doctor associated with that group charges an excess charge or none do. When you have a hospital, either every doctor that is in that hospital charges an excess charge or none do. You can't have it a mix and match, and you cannot get a surprise bill. And again, please see my video on excess charges are dead to see that the probability of an excess charge is well under 1%. It's just not something to be concerned about. So next one, are Advantage plans okay for those of us who travel? No, it's a short answer. So there are some Advantage plans and some Medicare supplement plans that will have overseas coverage for those who are traveling, and it's typically emergency or urgent care. That's it. Now with a supplement plan, you can still go all across the country. If you go overseas, you've got, with most of those, some sort of up to $50,000 of coverage. With an Advantage plan, if you go out of your service area, so if you could be in one part of Texas and go to the other part of the Texas, well, you then only have emergency and urgent care coverage. Or if you travel, somewhere within the United States, or you're RVing, your coverage is very, very limited. And in order to get, so if your life is in danger, or if it's an urgent care, it covers you. But if your life's no longer in danger and you're sitting in a hospital bed recovering, well, that's not urgent or emergency care, and you need to get back to your location, to where you actually lived and purchased the Advantage plan, or you're not going to have any coverage. Okay. What if I don't shop my Medicare Advantage plan during the annual open enrollment period? Good question. And this concerns actually both your prescription drug plan and your Advantage plan. If you have an open enrollment period from October 15th through December 7th, that's a period of time where you get to see the next year's plans, the changes that will happen. Again, it's only Advantage plans and Part D plans that have changes. And you get to choose whichever plan that you believe fits your needs. If you don't do anything at all, then the plan you have will simply roll over into the next year. And then you'll have that next year's version, which is different than this year's version, but you're not going to lose a plan. It's not like you have to shop or you lose a plan. It's you have to shop or you're stuck with whatever you have. And with Part D, that is all you have, October 15th through December 7th. With a Medicare Advantage plan, they do have another window, which would be from January 1 through March 31, where you can make one change to correct something so that you can, either move to a different Advantage plan or go back to original Medicare. But if you do nothing, it simply rolls over to the next year's version of the plan you have. All right, next question. How do I know if my doctor accepts my Medicare supplement plan? Great question. Very simple answer. All doctors that accept original Medicare must accept all supplement plans from all insurance companies, period. Now, the reason this is they don't bill the Medicare supplement company. They just bill Medicare. So when a doctor is a participating provider with Medicare, then they bill Medicare, and Medicare is their one-stop biller. Medicare takes care of everything for them. They notify the supplement, tell the supplement what to pay, and then the supplement automatically pays the doctor. And these things are all electronic now, so with most companies, it's between, any larger insurance companies, any of the larger supplement plans, between 85 and 90% of all claims are paid electronically without human intervention. So your doctor, if you go into a doctor's office and you show them your supplement card and the person behind the desk, says, oh, we don't accept this insurance. We only accept these on the wall. Well, they're looking on the wall that you don't see there is their list of Advantage plans that they accept. And they're incorrect in what they're doing. They're poorly trained. There's actually rules with Medicare and very serious fines, like $10,000 fines to doctors if they have that poorly trained of a front office staff. So you can, insist on speaking to somebody more knowledgeable, or simply hand them your red, white, and blue Medicare card and say, bill this, and that will actually take care of everything for them. All right, here's a good question. My Advantage plan had a maximum out-of-pocket of $7,000, but I paid over $30,000 in Medicare bills last year. How can this be? Well, unfortunately, we see this a couple times a year. With an Advantage plan, your maximum out-of-pocket only pertains to the procedures that the Medicare Advantage plan insurance company approves. That's it. If you're out of network, of course you're going to pay more. You have a higher, typically have a higher maximum out of pocket, but not that high. Well, what happens is sometimes people are declined. The insurance company says they're not going to pay for a procedure that they know they normally would have, and instead of appealing, which is what we suggest to do, they go ahead and have the procedure anyway. Well, in that case, it's all on you, 100%. You pay everything and there's no maximum out of pocket. So with an Advantage plan, you have to be careful. The maximum out of pocket only pertains to those procedures the insurance company has approved. So here's another one we get on a regular basis. So Medicare Part A and Medicare Part B cover drugs, but they don't have a drug list. How do I know, what Part A and Part B cover? Fair question. Well, we'll start with Medicare Part D, your prescription drug plan. That plan is for those prescriptions where your doctor, writes out a prescription and you either pick it up at a pharmacy or have it, get it mail order. Medicare Part B outpatient drugs are for those drugs that you receive as an outpatient, typically at a medical facility and administered by a medical professional. Medicare Part A is when you are an inpatient in the hospital. When you're an inpatient in the hospital, all of the drugs that you get are under Part A. Another question. My doctor stopped accepting my Advantage plan and it's in the middle of the year. Can she do that? Yes. You're obligated to the Medicare Advantage plan. Okay, but the doctors are not obligated to the Advantage plan. Their contract with them does not go on a calendar year basis. It can go from February to February or July to July or whatever. And if that contract runs out and they don't want that insurance company anymore, they can simply stop accepting it. Your remedy, you have to find a different doctor. And this can happen with hospitals too, by the way. All right, last one. I want to compare my Advantage plan to my Medicare Supplement plan or Medicare Supplement Plan Choice or my employer plan. And I want to include all of the premiums that we would pay as well. How do I do that? Well, great question. As a matter of fact, I created a calculator that will help you do that on the website under the Resources tab. So MedigapSeminars.org, click on Resources, and you see your Medicare calculator. And you can, and with that, compare either an employer plan or an Advantage plan to the Medicare Supplement Plan G, Plan N, or the high deductible plan. So you need to put in what the Medicare Part B costs are. You need to put in some of the basics that are covered actually under my Medicare sheet, as far as the premium and the deductible and so on. And with the supplement plans, it walks all through that, what your premiums would be as well. But anyway, you put in all that information, and what it's going to do is spit out what it's going to cost you if you have a $10,000 medical bill. So if you have a $10,000 medical bill, how much are you going to have out of pocket for medical services and or for premiums? And you can very quickly take a look and see which would be less costly. And you don't have to compare by trying to look at this service versus that service. Really, the bottom line is, if you have a $10,000 medical bill, what did it cost you to have your insurance and how much did that insurance cover you? Pretty simple stuff. So that's it for today. And if you have any questions that I didn't answer, please post them in the comments section below. I will do my best to answer these questions for you. And also please subscribe. You saw through this video I was linking to a lot of other videos I've done. If you haven't seen them, it's probably because you've not subscribed and you've not been able to find all of my videos. So please like and subscribe this video and help yourself and others find the videos that I have out there to help you with your Medicare. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.